Welcome to this very short presentation which gives an overview of our programme on healthcare improvement and patient safety here at Plymouth Medical School. Our goal: to provide a really outstanding educational experience for all of our students, really stems from the setting up of the Peninsula Medical School here in Plymouth almost 20 years ago. From the outset, there was a determination to help our students have a really positive impact on the healthcare systems in which they were studying, in which their placements took place, and where they'd eventually find jobs after graduation. This ethos carries through into our master's level learning and is characterised by these principles listed here. We wish that all that we do in terms of academic study then translates into ways in which you can take your learning back to the workplace, so that everything we do is clinically relevant, practice-based, implementation-focused, and has a real positive enhancement on the health communities in which you're working. To that end, our assignments are very relevant to clinical practice, and many of them take the form of projects which you can take back to your workplace, and many of our students have done this very successfully in the past and found there's a really positive relationship between what they learn on the course and what they can take back and implement into the clinical workplace. Our courses also, similar to our undergraduate programs, are also very highly interprofessional at postgraduate level. So if you come to study here on our healthcare improvement and patient safety programme, you could easily find yourselves rubbing shoulders with specialist paramedics, nurses, physicians associates, doctors at various stages of training across a wide range of specialties, and also ODPs, and also some academic staff who are working in the healthcare sector. So it's a really wide range of students that you'll be mixing with, and we find this creates a really diverse and enriching learning environment. One of the other characteristics of our master's courses is that we are very flexible. So if you need to take a year out of your studies to then go and do some professional exams or to take time out for family reasons, then you can do this. And so our 3-year part-time masters you can actually take over 6 years in total. So we're going to be as flexible as we possibly can be, which we hope fits with your work and caring responsibilities. So if you're interested in all of this, in improving patient outcomes and healthcare systems through simulation-based education, a range of quality improvement techniques and human factors, then this programme will equip you with all the skills to turn your ideas into implementation. Through it, you will develop the knowledge and expertise to analyse healthcare safety, propose evidence-based improvements, and lead new initiatives in the clinical environment. So why study healthcare improvement and patient safety? Well, here is a list of some of the advantages that our students take away with them from studying on our programme. Firstly, clinical staff are all the time being asked to do more with less. There is a constant imbalance of patient demand, the complexity of that demand, and the resources that we're given to meet that demand. Through studying on our programme, you will learn about ways to analyse healthcare systems and set up improvements which will better equip you to meet those demands in your service and across the system. Quality improvement experience is highly valued at job interviews across all professions. Regrettably, despite technological advantages, patient safety is still an issue, and the NHS has recently issued a new patient safety curriculum in an effort to meet this. So by studying our programme, you will be ahead of the curve in terms of trying to meet those demands of that new curriculum. Simulation in all its forms provides many opportunities to enhance education and enhance patient safety when done well. And the module on this in our programme will help you design and run simulation programmes in an educationally sound way and which meets the challenges of patient safety and demand. Human factors and ergonomics offers an opportunity to optimise performance in all situations. We look at the physical and the human-related performance criteria that make an impact on how well a system functions. And finally, to round all of this off, By implementing quality improvement and patient safety and human factors initiatives, you will develop some leadership skills around this area of implementation, which is critical to taking your organisation forward in future. So I like to think of this as a big equation where patient safety plus quality improvement plus simulation and human factors equals learning organisations, and learning organisations are what we really need to strive towards in the NHS in future. Okay, let's look at the certificate stage of this course. At this stage, you will take 2 modules, patient safety and quality improvement, and either simulation and enhanced learning or human factors in healthcare. In patient safety and quality improvement, a brief synopsis of the module includes reviewing the current state of patient safety, understanding how to carry out incident investigations, learning about sources of error, doing some systems safety analysis, quality improvement methodologies, leadership for implementation, and how we go about the very important task of nurturing a safety culture. In simulation and enhanced learning, we will review the full scope of simulation modalities from part-task trainers to virtual reality surgical simulators and everything in between. We will look at how they're used and at what stage of your career they might be used. We'll spend a bit of time designing scenarios based on educational evidence and looking at how you maintain control of a scenario to optimise the learning that comes out of it. We will take apart and debriefing and learning, so that this very important aspect of simulation is covered thoroughly to enable you to design programmes which will really truly enhance the educational benefit of those that attend. We'll examine expertise and mastery, and we'll question critically how much simulation contributes to meeting those goals, or whether it just falls around the level of achieving competence and being a signing off process quite often. And we'll look at the dichotomy between simulation as a safe environment and that in which it's used for assessment, where it very much isn't a safe environment, and the impact of that tension. In the Human Factors in Healthcare module, we will look at how a whole system is affected in terms of performance by both the physical attributes of that system, the people that perform within it, and the pathways that exist within that system, the processes. And how these clinical systems affect performance, because we certainly know that they do. We'll look at optimising team performance, thinking about non-technical skills, and all of those crew resource management issues that we've heard about, which make up part of the picture of human factors. We'll appreciate the importance of ergonomics. The physical environment really does impact on how we all work, and I'm sure you can all think of situations where it has not been set up in an optimal way to allow you to perform your work. Looking at the processes, we'll dissect the system to understand work as done as compared to work as imagined, and look at the detail of how a system functions, because if you don't understand that, it's very difficult to make an improvement that really works. And we'll be applying and looking at all the time throughout this module at high reliability industries and seeing what we can learn from those industries and actually where the limitations in that learning might fall. So let's take a closer look now at the diploma stage modules. So if you're doing this programme as a part-time 3-year course, this will be the second year of your studies, and it will comprise 2 modules. The first of these modules takes place in the autumn semester and is called Project Design, Development and Knowledge Transfer. The whole ethos behind this module is helping you to design a robust research methodology for your dissertation project. Now, when I say research, that is with a lowercase r, because you may well end up doing a project that is a quality improvement, a service evaluation, a systematic review. There are a number of different methodologies that can be used during your dissertation, depending on what you're interested in and what you find relevant to your service. And so it doesn't necessarily have to be a pure research project. And this module is all about allowing you to explore the different methodologies available to you and what's the most appropriate way to tackle the things that you're really interested in studying during your dissertation stage. Following this, in the spring semester, you will choose one of the following modules, either Human Factors in Healthcare or Simulation and Enhanced Learning, depending on what you did during your first year. Then you'll go on to your dissertation in the final year, where you take forward the project that you've proposed in your project design module and spend the whole year doing that project and under the guidance of at least 2 supervisors. And we hope that this proves to be a really interesting, useful exercise in taking on the role of a researcher or service evaluator in improving your service. And we've had a wide range of very successful projects throughout the course of this programme. So the last 2 slides summarise the routes through the part-time and the full-time route of the Healthcare Improvement and Patient Safety programme. When you get to the dissertation stage in either route, this is your real opportunity to investigate and spend some time on a project of great interest to you in terms of your clinical service or your professional interest. In the past, we have had dissertation projects from this programme looking at the attitudes to incident investigation in paramedic services, projects looking at human factors systems analysis using the Fram method around paediatric theatres, systematic reviews of non-technical skills, and investigation of debriefing structures in undergraduate medical education. So there's a wide range of projects that you can get your teeth into through doing this programme, and this is certainly not an exhaustive list, it's just a list of examples that we've had recently. On this slide there's a selection of feedback from various students across all of our modules over the last couple of years, and we hope this gives you a flavour for the enthusiasm and dedication of our faculty in making this a really vibrant and creative course. And we pride ourselves on the fact that many of our modules adopt some quite creative ways to learning, and we hope you find this enjoyable and stimulating and also thought-provoking in how you take forward your work in the future. So here's a screenshot from one of our teaching sessions on one of our modules. Have a look at it and think, could our programme help you to accomplish some of your goals? If you want to carry out your own personal improvement project, which will equip you to do your current work better, provide you with the skills to get ahead in your career, as well as being a really enjoyable course, our MSc in Healthcare Improvement and Patient Safety could be exactly what you need. Our faculty teaching team features national experts within the fields of simulation, patient safety and human factors. And they all have considerable expertise in supporting students to use the learning on our courses to make real changes in their workplaces. If after listening to this brief presentation, you are interested in improving your workplace, improving the quality of care and the safety for your patients, and interested in improving your career prospects and your job satisfaction as a result of being able to do things, to make a difference, to make a change within your workplace, then do please get in touch with us through any of the means on this slide. Obviously, at this time, we cannot guarantee you what the future holds, but you can be absolutely assured of our commitment to make your learning journey as fulfilling as possible, as clinically relevant as possible, and as enjoyable as possible. So, if you would like to find out why there was a Mr. Potato Head on the very first slide of this presentation, please get in touch with us. Please join. We really think you will value every step of this journey. Many thanks for listening.